In the MDS session, we are going to be discussing a lot of advances, especially in lower risk MDS, where we now have a number of drugs that have improved our ability to get the hemoglobin higher, which is very important for quality of life of patients, as anemia is one of the main comorbidities and clinical factors associated with decreased quality of life in MDS. So there are now drugs like luspatercept as well as imetelstat, which have shown that they can improve the hemoglobin in patients with MDS with low-risk disease, which can then lead to a better quality of life for many years. Then this is important because in low-risk disease, often these patients may have survival of many years, but the key issue is the cytopenia management. And both these drugs now are being used more and more, and even looking at potential combinations of luspatercept with the traditional erythropoietin-stimulating agents such as Procrit, Aranesp, which may further boost the hemoglobin responses. For the higher risk or higher blast MDS, there's an effort to build on the current FDA frontline standard of care approvals with the hypomethylating agents azacitidine, decitabine. We are all eagerly awaiting the results of a randomized phase 3 study called the Verona study that will look at azacitidine venetoclax versus azacitidine placebo. The study has been completed about 1.5 to 2 years ago, and we're waiting for the survival endpoint. If positive, which we all hope and are looking forward to, then this could lead to a new standard with the combination becoming the frontline approach, hopefully with better efficacy, better depth of remission, and more transplant rates, eventually leading to longer term survival and cure rates. There's also a lot of efforts to look at various immune pathways in MDS, such as the interleukin pathways with canakinumab-based therapies, as well as potentially new CD123 targeted bispecific antibodies and cellular and CAR T therapies. These are early stage, but I think may be very important for the future in MDS treatment.